First at 5, the fight to save a local hospital's birthing unit and the jobs of those who work there is heating up. As we first reported at noon, nurses and dozens of others staged a demonstration outside Care New England protesting their plan to shut down the birthing unit at Pawtucket's Memorial Hospital. But Care New England says it is a painful but necessary cut. Eyewitness News reporter Jared Pleiner is live outside Memorial Hospital in Pawtucket with the new details.
Mike Shannon, good evening. Care New England has called the financial situation here at Memorial Hospital dire, with millions in operating losses. The union says this move came without warning and will be a roadblock to care for many who will have to travel elsewhere. Dozens of those with United Nurses and allied professionals picketed outside the Providence office of Care New England CEO Dennis Keefe Thursday, decrying the proposed closure and relocation of Pawtucket Memorial Hospital's birthing center. Rita Brennan is a nurse there and a union leader.
They said probably around 200 jobs.
Care New England tells us it hasn't formed an estimate. Brennan says moving obstetrics and the ICU would violate health department approval from 2013 when Care took over.
There not being any changes to primary or specialty care services at Pawtucket Memorial Hospital for 3 years. Those services would remain within that community.
Angeline Peters-Lewis is the nonprofit's chief nursing officer.
We believe we're delivering on that promise by making sure that they have access to care at Women and Infants, which is world-renowned, as I've said before, and also at Kent Hospital if they want a little different community experience.
Eyewitness News dug up that 2013 approval signed by then Health Department Director Michael Fine. It reads, "No elimination of clinical services is envisioned." And in this footnote, Care New England does not contemplate the same during the first 3 years. A Health Department spokesman tells us that language was not listed as a condition of approval. We found a map of Memorial's primary service area. It stretches up through Cumberland and Attleboro, down into Providence and East Providence. And as before, the Health Department must review and approve all of this. Public comment meetings are set for here in Pawtucket and Central Falls next week. 3 different days. We have all the information on our website, WPRI.com. And coming up new at 6, what employees here and patients have to say about all of this. Live in Pawtucket tonight with the Blackstone Valley Mobile Newsroom, I'm Jared Pleiner, Eyewitness News.
Dozens of healthcare workers rally outside Care New England headquarters to protest the proposed shutdown of the birthing center at Memorial Hospital in Pawtucket. And new at 6 tonight, we're hearing from patients saddened to hear about the potential cutbacks. Eyewitness News reporter Jared Pleiner is live in Pawtucket tonight with the Blackstone Valley Mobile Newsroom.
Mike, that's right. At 5 o'clock, we brought you what Care and union leadership has to say about all of this. Now, more of the people who work in the trenches here and people who have had children here. Union members and others picketing the proposed closure of Pawtucket Memorial Hospital's birthing unit outside Care New England's Providence office. Nurse Christina Lambert used one word:
helplessness. This is really an issue of access. The patients who cannot be here today because they cannot get here today are going to have the same issues trying to get to Women and Infants or Kent.
The nonprofit says its flagship is minutes away in Providence.
We have a world-renowned institution in our system, and it makes sense that patients would have access to that care and be able to receive care in that type of environment.
Care New England calls the financial situation at Memorial dire, millions in losses. The union says it was told about 200 jobs would be impacted. Care says it has no estimate yet. Megan Coelho had 3 children here. She came out with her son to protest.
To support the choice of where you want to give birth in Rhode Island. I can't imagine my children not having the choice of Memorial.
Thomas Crowshaw's daughter Haley was born at Memorial just 3 weeks ago. Back in the day, so were his family members.
Mothers and families should have that opportunity to do it their way and not the way that a hospital tells them, and that's what they get at Memorial.
It's unclear what we'd be talking about in terms of layoffs or absorption into other system hospitals. The health department, of course, has to review and sign off on all of this. And there are meetings, community ones, scheduled for next week. Representatives of Care will be there, and we have all the information on where those will take place. They are in Pawtucket and Central Falls, but all that's on our website, WPRI.com. Live in Pawtucket tonight with Blackstone Valley Mobile Newsroom, I'm Jared Pleiner, Eyewitness News.